bother me at all.
At this time, I'm not concerned, no. I'm not at risk because I'm healthy and young, so I'm not too worried about it.
I'm not too afraid. First of all, I'm on home. I just had back surgery, so I'm not going anywhere for a while.
No, not as much. I guess we're just cautious, but practicing good hygiene has always been like a safeguard for not getting sick. So, but we haven't been as paranoid as, but we are mindful.
Honestly, no. I like to watch a lot of things from scientists about the coronavirus versus just the news, because the news sometimes will sensationalize stuff, and they can also downplay stuff that you should be concerned about.
Definitely, I'm not more afraid, but I'm more conscious, definitely, about, how dirty are your hands and all that sort of stuff. And that's why I'm just like, oh, if I'm like really itchy, like I'll just like scratch myself with like my elbow now. Like, yeah, I'm definitely more conscious about it, but I wouldn't say I'm more afraid.
At all.
To just stay, away from public places and
I probably would avoid cruise ships, and I would avoid airplanes. Maybe I'd avoid like big crowded places, but otherwise I'm okay. And if I were to go out and do shopping, I would just not touch my face, and then when I got home I'd wash my hands with soap for 20 seconds.
that's great.
So I'm not too worried.
So I personally don't worry because I don't go in big crowds. This is kind of what I like. But yes, I think people in large crowds, if you're going to the airport, if you're going to places where masses of people are congregating, like you said, a festival or something of that nature, yeah, you're going to have to be a little cautious because, again, you don't know who has what or who's a carrier and who's not and who's, just regular sick. So
Yeah, I would still do it.
At all.
Yeah.
I don't really have an opinion. I mean, I think that right now they're just concerned with having enough for people who, healthcare officials and stuff like that who actually do need to wear masks. So that's why I think there's a concern, because people are stockpiling on masks that don't actually need them. Because if you're healthy, you don't need to wear a mask. I don't really have an opinion either way, but I think that's why they're concerned with
To
it.
go outside?
It's been proven to not help, so no.
I don't think most of the face masks are really working, and when
No,
you're
they'd say
outside
not
like
to
this,
wear them.
it doesn't make sense because
Wash
there's
your
all this
hands.
fresh air.
From a CDC or?
I think that the masks work if they're a 95 and if you're in an enclosed space. But when you're outside, I don't think it makes any difference.
The public health experts say that masks are ineffectual and you're more likely to pick the virus up on your hands. And I'm not that concerned about it because compared to like the plague in the Middle Ages that killed 25% of the population,
This is killing 2%.
this kills at most 2%,
But I
probably
worry
less.
for the old people and the
Yeah,
children.
I think this is like we have higher expectations of our medical system than during the Middle Ages.
Yeah.
And of course, people are healthier on the average than during the Middle Ages. But
it's a scary thing, and it's going to spread, and it's going to keep spreading, and there probably won't be a vaccine for 2 years, is what I heard. So that's bad.
Yeah.
Listen, like
Our
nurses,
medical friends are like,
like,
you
I live
do
with-
not need
yeah.
to wear a mask unless you're sick.
trucking, great for you. I'm not gonna freak out. Now, if I see somebody coughing, I might kind of do a little. So if you want to wear a mask, hey, feel free to wear it because no one's gonna be there to help you if you do get sick.
Oh, if people want to wear face masks, that's great. We did some engineering projects on like computational fluid flow, and people, like, if someone sneezes in a room, like the spread of the bacteria in like a big room is crazy. So
This is what you're convincing people why they should be wearing masks.
yeah, exactly. I don't think it really works that well. I has masks or like suits or something. I don't know. No. If I was sick, like I would just stay inside. But like I'm not. Yeah, I don't feel like I need to wear a mask
At all.
Yeah, just right here. Yeah. Well, since there ended up being like 20 people that did have the virus, I think it was a good call to test them before they just like are loaded up into the public without knowing if they had it or not.
Really worried about it, right?
Yeah, not worried.
Okay.
Okay, come watch it come through the Golden Gate tomorrow.
Too close
No.
and get.
No, because they're going to take them to hospitals and to military
hospitals.
bases.
Yeah, it's
Yeah,
over there.
We just saw
They're
it.
gonna be
Yeah.
there for a couple of days because it's gonna take them a lot of time to offboard.
So I just feel bad for those people because I've been on cruises before, so I know if you don't have like a fancy room with a window, you're probably just really annoyed that you're sitting there. But I totally understand why they have them there because again, you can't force everybody to wash their hands or cover their mouth when they cough or sneeze. So I get being overly cautious and keeping people there and just trying to weed through who has what, especially since you've already have 21 confirmed cases. And for people who've been on cruises before, they know that there's like sanitizer everywhere. But again, you can't force people to use any of that. So,
That's crazy. Oh my god. But they've quarantined that group of people.
so-
But I think the people that aren't sick, maybe they should be allowed over. Maybe. I don't know.
Fear is definitely not the answer, is the thing. I mean, like, the whole frenzy buying thing is the symptom of a dysfunctional society rooted in individualism.
Yeah, wash your hands very frequently for 20 seconds at least. And if you're concerned about it, avoid super public places.
Doesn't matter, just washing your hands.
listening to them, washing your hands, staying away from sick people. If you're sick, stay away from people because it's just rude in general to be coughing and sneezing into the air.
Yeah, wash your hands, don't touch your face, like you said. That's all. Thank you for doing that.
Yeah.
I mean, like, this is the problem with the Chinese people, is that Chinese people in the United States are, like, buying rice in supermarket, like Costco, like, with their black mask on. Like, all the other people are like, Chinese people are crazy and they look like they're sick. This is why we should not talk to Chinese people. It's creating racism against Chinese people. We just stop making ourselves look like crazy people. So then other races would not be racist against us. And it's our own fault for acting crazy. Stop being crazy.
It's going to be tremendous impact on the world economy.
Yeah,
There's a
it
supply
sure
chain
will.
disruptions.
It's gonna really-
There's a massive plunge in oil prices because
We're kind of
there's no
hoping that it
demand.
hurts Trump, even though it's a terrible thing to say.
Allowed to test.
They don't have them yet.
Oh, it's just
they
they
don't
don't
have
have
enough
the
kits.
test.
Most the advanced country, right?
But they,
No,
they,
with Trump
they
in
messed
charge.
it. They messed
Trump
it up.
doesn't know anything.
The first kits they came up with didn't work.
Yeah, and
So
Trump,
now they're just slowly
Trump's
gearing
an
up.
idiot, and he claims he knows more than he's aware.
We don't know why the Center for Disease Control made the decision they did to develop their own test. It's very dumb.
Right, instead of going.
Thank you.